Save a life. First aid refers to the emergency or immediately care you should provide when a person is injured or ill until full medical treatment is available. For minor condition, first aid care may be enough. For serious problems, first aid care should be continued until more advanced care becomes available. The decision to act appropriately with the first aid can mean the difference between life and death. Begin by introducing yourself to the injured or ill person. Explain that you are the first aid provider and willing to help. The person must give you permission to help them. Do not touch them until they agree to help. If you encounter a confused person or someone who is critical injury or ill, you can assume that they want you to help them. This is known as implied consent. First aid basic. The first step is any emergency is the recognize of a problem and providing help. When adopt or when someone is seriously injured or ill, you should always activate the emergency response system by calling 911 in the United States or your own locality emergency medical service. If you are not sure how serious the situation is, the 911 operator will ask you a serious question to determine the severity of the situation. Remain aligned until additional help arrives or until 911 operator tells you to hang up. Emergency system dispatchers can guide you through the step of performing cardiopulmonary res- resuscitation or CPR using automated external or delivering basic care until additional help arrives. Scene safety. Assess the safety of the surrounding is critical when approaching any scenes. You do not want to become another person who is injured or ill, so look for any potential dangers. Remove the person from any dangers, such as presence of the water at the sense. Be special alert to the avoid danger from automobile traffic. Very important is hand washing and personal protection gear. You need to be a washing technique is fairly simple. Completely wet your hands and then you will apply soap. Rub vigorously for the least 20 seconds. Rinse your hands with plenty of water and dry your hands with a towel of air. Using personal protective gear is an important strategy to minimize the risk of the blood and bodily fluid exposure. If the person is bleeding, always wear gloves and protective eyewear that give him first aid care. The universal prescription is to use personal protective equipment whenever there is possible exposure to blood or bodily fluids. It reduces the risk for both the rescuer and the injured ill person to be exposed to the blood-borne disease. Gloves protect your hands from exposure to blood and other bodily fluids, while eye protection provides accident exposure from splashing fluids. Consider a pocket mask as part of a person protective gear as a province provides safety during rescue breathing. Be sure to dispose equipment that was touched bodily fluids in a biohazard bag when available. When taking out gloves, avoid touching the other contaminated surface. Slowly pull one glove or while training in it inside out. Place the glove in the palm of the other glove and the and and then remove the second glove while training in inside out. Consider purchasing the commercial avoid first aid kit or making your own having kit in your home, your car, and your place at work is essential to save preferred. Thank you and goodbye.